adult cardiac arrest algorithm. So firstly, we start CPR, and what we do is administer the oxygen as well as we attach the defibrillator. Next, what we do is we see if there is a rhythm which is shockable or not. So in case it is shockable, yes. This is in cases of the ventricular fibrillation as well as the PVT. PVT is nothing but the pulseless ventricular tachycardia. So in case if it is no, in case no, it refers to the asystole. Asystole as well as the pulseless electrical activity. This is nothing but PEA. Next, moving ahead, the further sequence of the, in case of the ventricular fibrillation or the PVT. So in such case, what we do is firstly there is the defibrillate, and there is also an immediate resuming the CPR. So the CPR is resumed for 2 minutes, and even if the defibrillator has not worked, and along with that there is IV or the intraosseous access that is given. Next, what we see is we look for the ROSC. It is nothing but a return of the spontaneous circulation. If ROSC is maintained, suppose it is yes, then what we do is the post cardiac care is given, arrest care. Now in cases of the ROSC, if it is no, what we see is if the rhythm is shockable. So if it is non-shockable, if the answer is no, what we see is the management of the asystole, managing the asystole as well as the PEA. Next, we see if the rhythm is shockable. So in case the rhythm is shockable, there is, in case if it is yes, further there is the defibrillation that is done, defib, and this is along with the CPR. CPR is done for 2 minutes, and then there is also administration of the epinephrine, and the dosage of epinephrine is 1 mg, and this is every 3 to 5 minutes. And what is done is consider the ET intubation is also considered. Now again, this can lead to ROSC, that is return of spontaneous circulation. So in case yes, we again go to the post cardiac arrest care. And next, in case the ROSC is no, there is no ROSC, then we look if the rhythm is shockable. So to continue it, if the rhythm is shockable. So in case the rhythm is shockable, if it is no, what we see is the management of the asystole or the PEA, and in case the rhythm is shockable, yes, then what we do is again defibrillation, and this is along with the CPR. This is done for 2 minutes, and next there is also the amiodarone, or the lidocaine is given, and this is done along with the treating the reversible causes. Now, in case the ROC is maintained, if it is yes, what we see is the post cardiac care arrest, and in case it is no, what we see is it goes back to the first step where the rhythm is shockable or not. Next, what we are seeing is in case of the asystole or in case of the PEA. So in case of asystole or PEA, we look for the intravenous or the intraosseous access. This is along with the epinephrine and the continuing 1 mg, and this is done for every 3 to 5 minutes. Along with this, the CPR is also done, and this is for 2 minutes with the ET intubation. Next, what we see is the ROSC. So if it is yes, we have seen throughout that the post cardiac arrest care is administered, and in case it is no, what we do is if the rhythm is shockable. So if it is no, the rhythm is not shockable, so here what we do is management of the VF or the PVT. Next, we see if the rhythm is shockable or not, and here if the answer is no. If the rhythm is shockable or not, answer is no. So here what we do is CPR, and this is done for 2 minutes. Now, along with it, there is the reversible causes. Causes are treated. Then what we do is we look for the ROSC, and in case if it is no, what we do is we see if the rhythm is shockable. So previously, if the ROC is yes, we know it is post cardiac arrest care that is given. So again, in case of the rhythm is yes, it is shockable, then what we do is management of the VF and the PVT is done. And in case no, this gets back to the step where the IV is administered, where the IV or the intraosseous access is done along with the epinephrine and ASAP, and continuing 1 mg. This is 1 mg every 3 to 5 minutes, along with the CPR for 2 minutes, along with the ET intubation. So it gets back to this step.